I would imagine, which is often the case a lot of times with folks that are in the medical community, sometimes you may come across a patient who wants you to be a miracle worker. They're coming to you for miracles. They're banking on miracles. How do you work with that?
In the sense that they think that that they're going to be absolutely cured regardless of the outcome. I call that faith. The substance of things hoped for, the evidence of things not seen. But I am a scientist as well. So I combine the two. I explain to the patient, again, the studies that have been done, the outcome that can be expected. But as we all know, when we are involved in research, statistics, right? When we present the results, it's all about the average, right? They're always outliers, right? So I, of course, convey that to my patients as well. If the subject is introduced regarding miracles, I believe in miracles. How could I not believe in miracles? I mean, I was saved from a car accident in which I should have died. That's a miracle. So I'm not one who doesn't believe that a stage 4 cancer patient could not somehow have a PET scan 6 months later and shows absolutely nothing. Oh, absolutely not. Because again, whatever is impossible for man is possible for God.
Right.
So I would not ever tell a patient, I give them the facts, medical facts, but luckily I'm also spiritually inclined that I believe in miracles. I know they exist. See, when we read the Bible, we somehow separate what happened then from what is possible now.
Today, right.
It's not a storybook. It's real. And the progenitor is real too. He is real. He never changes. And actually, he told the disciples that they will do greater works, right? So when I envision, if I ever had a philanthropist, right, who decided that they are really impressed, or my tenets, my principles, my clinical approach is, resonates with their beliefs, that center I would create would also, and establish, would also include that spiritual element where there are prophets, there are healers that God has given the gift of healing, right? So that would be a center on my campus, so to speak. I would treat with conventional medicine, but it would be a resort where my patients can actually experience relaxation, etc. All of those amenities that I wish I could offer my patients. For example, I have this program. I have massage that I don't have time to ever do for myself. So I found a way to credit my patients with the Massage Envy credits, where they can go and have a massage done after, once they've completed treatment, etc., facials, etc. So if I established a center, it would have all the amenities: counseling, therapy, conventional treatment, because I am a physician, so I do believe in conventional treatment. But I also believe, and if my patient is so inclined, of course, then there would be an actual spiritual center. And I know that there is an uprising of the gifts he spoke about. He didn't speak about the gift of healing because it doesn't exist. I mean, Raphael is the angel who walks with you when you perform healing miracles, right? Raphael is the angel for healing. I mean, there are several angels, right? Gabriel is the angel of good news. He's the one who gives good news, to Mary, John's father didn't really accept that news so well, which is why he was, made dumb for a few, the story. Mm-hmm. But the point is, Gabriel is the angel of good news. Michael is the fighter, right? He's the guy who combats in the spiritual warfare, right? And Raphael is the angel of healing. So when God says we're given gifts of healing, and so that being one of God's gifts, I do believe, and with the uprising of prophets, I don't know if you've noticed, but the Bible clearly states that in the last days, first of all, He will pour out His Spirit upon all flesh, right? Your sons and daughters will prophesy. But what is interesting about the question you just asked about someone not believing is that the Bible clearly states that every knee shall bow and every tongue shall confess that He's Lord. So the point is that our soul does know that He is Lord, right? Whether or not you confess it now. So that center would include just that. And I know that's somewhat of a protracted, maybe circumlocution, possibly, that I was engaging in, responding to your question, but it would actually include prophetic and spiritual guidance. And there would be a separate center for that on my campus, because it wouldn't just be a building, it would be a resort where I would offer every amenity, including treatment, support, side effects, etc., treating side effects, everything that the patient would need.
Is this something that you are working towards now?
That's my
vision. The creation of this center? Are the wheels turning in that direction?
This is the vision that God gave me. So to answer your question, you being in tune with His voice and His Spirit, whenever He gives you a vision, it's nothing that you can accomplish on your own, or it wouldn't be from Him. It's always something that you can't do without Him. And so, being given this vision, I know that it will come to pass. He will send the destiny helpers. He will send everyone I need, because that's not a vision that I concocted on my own. This is His vision.
Collaborative.
It's His vision. Oh, absolutely. It's His vision. He wants that for His people.
You mentioned if there was a philanthropist out there, and they shared the tenets and the philosophy. And tell us what those are. So, treating a patient not just as the cancer, but treating the whole patient. All the elements of His lamp being infused in a patient: hope, identity, self-esteem, rehabilitation of the mind, purpose, also addressing the psychological aspect that roars its ugly head when you are facing your mortality, and addressing that in a manner that is effective, not ignoring it and just focusing on the cancer. Also, allowing for a more expansive and also a flexible approach to treating patients. And that includes not just the conventional approach, but homeopathic as well. And of course, the spiritual aspect. So those are the tenets and the principles and the philosophy. And of course, family, not just the patient. So everything that I've spoken about today and all the contents of this book, it includes all of that. And so if there is a philanthropist who would be willing to fund that, that would be
those are the intangibles, and of course some of the tangibles as well, that would need to resonate and not just on a superficial level, but deep down, something that, as I said, deep calleth unto the deep. So the seed, a seed that is planted, even if it's the size of a mustard seed, it will eventually grow. The reason that mustard seed is referenced, because it's one of the, it's a very tiny seed, but when it grows into this huge tree.
Yes.
Right? Exactly. So whether or not all the elements fit, once the seed is there, you can't ignore it. It's similar to me writing this book. Once the seed was planted, even if I tried to convince myself that this was not something that I need to do, I had to do it, because it's similar to Jeremiah when he said, it feels like a fire shut up in my bone. You have to. You literally, you cannot walk with that inside you, or else you'll explode, right?
That's right.
Exactly. And so I am hoping that, and it's not just hope, it's faith. Faith is the substance, right? And so I know that if he gave me that vision, then it will come to pass. And he's the author and finisher of our faith. So I have the faith, and he authors it, and he finishes it.